Good afternoon, ladies and gentlemen. Thank you for being with us here on what is an historic day at Niagara University. A couple great announcements for us. Just some protocol pieces, just so you know, we'll have some refreshments after the event. Feel free to stay around. Ask you to keep your masks on unless you're eating, of course. For the speakers, you can take your mask off if you like when you come up. And I think that covers all of our protocol pieces. As I said, it's a great day, and I'm not going to steal any thunder. I'm going to turn things over to our Provost and Vice President for Academic Affairs, Dr. Timothy Ireland. Tim?
So, straight up, I'm not educated in nursing. And I have the fortune to serve as Provost here at Niagara University. I have a criminal justice background, and so for the last 8 years as a Dean and as a Provost, the nursing faculty, along with Fran Crosby, have walked very patiently with me as I have learned the language of nursing. And so I have two very important announcements this afternoon, so thank you for joining us. First is, I'm incredibly pleased and proud to announce that the Board of Trustees in March of this year voted to reestablish the College of Nursing at Niagara University. Yeah, it's a moment. Almost a decade ago, my friend, my colleague, and my mentor, Fran Crosby, worked diligently with the Dean of the College of Arts and Sciences, Dr. Nancy McGlenn, who's also an incredible mentor for me here at Niagara, to bring nursing education back to Mount Eagle Ridge. At that time, they started with an RN to BSN program, and it was linked to some degree with Catholic health systems down in Buffalo. Over time, as I transitioned into the Dean's position, and as Dr. McGlenn retired, both the accelerated nursing program as well as the 4-year BSN came online at Niagara. Currently, there are about 300 students enrolled in the nursing programs here at Niagara University. RN to BSN, accelerated, and the 4-year BSN program. The program is currently led by Margarita Coyne, who is with us this afternoon. She did just such a wonderful job navigating through the incredibly complex year of COVID and kept our nursing students engaged and working and learning over the past year under an incredibly complicated situation. So thank you, Dean Coyne. So that's my first announcement. My second announcement relates to the new Dean of the College of Nursing at Niagara University, Kirchstein Verney. Kirchstein is here with us this afternoon. Dr. Verney is a nurse with nearly 3 decades of experience in hospital, primary care, hospice, and in the academy. She has been recognized as a nurse of distinction in higher education. She is regionally known as a leader in nurse education, and she has completed and participated in prestigious programs like the National League for Nurses Center on Translational Leadership, the American Association of College of Nurses Elevating Leaders in the Academic Nursing, and the Health Foundation of Western and Central New York's Health Leadership Fellowship Program. Dr. Verney is the recipient of the National Research Service Award, and she's engaged in nursing leadership, outstanding teaching, and research over the course of her time. She has held positions at D'Youville College, Hospice and Palliative Care of Buffalo, UBMD, Emergency, Kaleida Health, Women and Children's Hospital, Strong Memorial Hospital, Boston Children's Hospital. I can't believe you've done all this. Boston Children's Hospital and the Cleveland Clinic. She has attended prestigious institutions, including SUNY Buffalo, D'Youville College, University of Maryland, and Canisius. I'm incredibly proud to announce Dr. Verney as the Dean of the newly established College of Nursing at Niagara University. Dr. Verney.
They always have a way of making you sound so good on paper. Well, so as not to make any faux pas, I did write down my speech, so I'll apologize in advance for looking down on it, but thank you so much. I am so excited to be joining Niagara as the Dean for the newly named College of Nursing. I really wish to extend my thanks to Father Marr, to Dr. Ireland, to the entire Board of Trustees, to the deans for the university, to the new College of Nursing's leadership team, as well as its staff, to the university faculty and staff, to the alumni, and to the greater community for having the confidence in me to appoint me to this position. You've all voiced your confidence in my abilities to move the institution forward, with nursing being the college of choice for nursing education in the Niagara region, in Western New York, and beyond. I assure you, I do not intend to let you down. With a transparent, progressive, and innovative culture, and with organizational strategic aims that foster excellence, team building, and expansion of Niagara as a binational university, the College of Nursing, under my leadership, looks forward to contributing to the long-term sustainability of Niagara with our current and future nursing program offerings. Why me and why Niagara, you might ask? This section will have a lot of I statements. Briefly, in the words of Father Marr, I know what must be done to advance nursing education. I have 2.5 decades of nursing expertise. I have worked as a registered nurse in acute care settings, as a nurse educator, and as an advanced practice nurse practitioner. I have 10 years experience in higher education, in addition to my experience as an academic dean. These collective opportunities have helped me develop a diverse skill set which will help me lead this college. I serve on local and national nursing organizations to advance our nursing profession, and this will help ensure that Niagara's academic voice is heard. I have the ability to effectively lead groups. I understand how to engage faculty and students alike to achieve positive outcomes. I have a willingness to communicate the needs of nursing academia, and I have an understanding of the tremendous responsibility and dedication to lifelong learning that accompanies a career in nursing. As the new College of Nursing trains the nurses of the future while following St. Vincent de Paul's vision by being innovative educators and combating social inequities, we plan to optimize collaboration with valued clinical partners throughout the duration of our academic program offerings. With these partnerships, we will identify what type of workforce and training is needed to successfully prepare our graduates. This will allow our graduates to be ready to address disparities and improve health outcomes wherever their nursing degree leads them. I am confident that on this journey, the College of Nursing team will showcase their skills and our students' many successes. We will work to expand opportunities and introduce new advanced degree options that are so greatly needed in this community. With partnerships locally, regionally, nationally, and internationally, we will highlight nursing's dedication to inclusivity and to the creation of a diverse nursing workforce, meeting students where they are while upholding the high standards of our nursing profession. Once again, please know that I am so very humbled at the opportunity to join Niagara, and I look forward to many more celebrations coming out of the College of Nursing in the weeks and months to come. Thank you.
Christine, thank you, and congratulations. Welcome to Niagara University. It's great to have another Purple Eagle with us today. The search process was mentioned a few times, and I know there are members of the search committee here. If you just stand for a second, let's recognize the people who brought us Christine. Don't be shy back there, Fran, of course. Chandra's here, Donna, most still are very good. Okay, perfect. So how about a round of applause from members of the search committee? Brought that forward. And that is the powerhouse table back there. So Tim mentioned it, but Dr. Nancy McGlenn, Dean Emeritus, Niagara University. Nancy, thank you for being with us today. Great to see you. Of course, Fran Crosby, Barb Malinowski, of course, the heart and soul of the nursing department and now the College of Nursing. Great for you to be with us. How about a round of applause for them? We do a lot here on the university campus and we try to tell people about it. And our students go out into the community in a number of ways, both as service, living the Vincentian mission in their communities, but in work. We prepare them for careers. And when they leave our campus, we know that they're prepared for careers. And that is great to have partners in healthcare when we do that. And we have two of our great partners in healthcare today we're going to hear from. First, the President and CEO of Niagara Falls Memorial Medical Center, Joe Ruffalo. Joe?
Good afternoon. And welcome, Dr. Verney. Welcome to Niagara. I had the pleasure of speaking with her prior to the event, and Dr. Ireland clearly articulated all of her accomplishments on her CV, but he neglected to include an additional full-time job that she has. Learned that she has a daughter that plays travel softball and is a junior in high school and is a pitcher in softball, which equals, for those of you that have daughters that play travel softball, you know that there are absolutely no free weekends. So she has two full-time jobs, one here at the College of Nursing and one trying to keep up with her daughter as she travels across the country. So it's hard to believe that it's been 3 years since we stood side by side with Niagara University and its president, Father Jim, to announce the RN to BSM program that's hosted on the campus of Niagara Falls Memorial to assist in addressing the critical nursing shortage. And as we all know, unfortunately, the shortage continues with contributing factors such as aging population, high retirement. I guess I could take this mask off, right? And significant turnover rates. As a matter of fact, last year, Niagara Falls Memorial alone hired over 70 registered nurses to deal with the turnover rate. And according to the American Nurses Association, next year, in 2022, the registered nurse professional position those jobs will be more available than any other profession in the United States. As a matter of fact, they estimate that there'll be over 500,000 registered nurses in the United States that will retire next year. And so when you couple that with the shortage, the need next year alone will be for 1.1 million new registered nurses. Couple that with projections going out to 2030, the U.S. Census Bureau reported that the number of residents aged 65 and over is projected to reach 82 million, which equals an increased need for geriatric care and care for those with chronic disease and comorbidities. Now throw on the global pandemic that we are currently in the throes of. Nurses found themselves in situations never seen before, working longer hours, working with evolving guidance that sometimes was changing daily on how to care for patients with COVID-19. And then there's the emotional and mental toll, the patient isolation, the fear of the unknown, the carrying the heart-wrenching load of helping families say goodbye to their loved ones, all contributing to added stress, burnout, and ultimately leading to nursing turnover. There was a study in the Journal of Depression and Anxiety that showed that 42% of healthcare workers surveyed that were screened positive for mood disorder and 49% had elevated stress levels, numbers representing an alarming rate of social and emotional needs among healthcare workers. But there's light at the end of the tunnel. We're so grateful with our partners at Niagara University, who time and time again have showed their commitment to addressing the significant needs of Western New York, as well as their willingness to continue to foster collaboration. So as we stand here today on the cusp of National Nurses Week, I extend my sincere appreciation to Niagara University and its leadership team. Your partnership, your support, your commitment to workforce development and economic growth in the Niagara region and beyond is truly, truly appreciated. And we could not be more excited and privileged to join you today in this announcement of the establishment of Niagara University's College of Nursing, a program that will ensure the critical role of nurses do not go unfilled across Western New York. Congratulations.
Thank you, Joe, for your leadership, of course, in our community and for always being there for us. It's great to have partners like Memorial and Joe Ruffalo. And just across the way, you can almost see Mount St. Mary's Hospital from here. CJ, I don't know if you walked over or drove over, but it's a tough walk, a little tough walk. Our pleasure to introduce the president of Mount St. Mary's Hospital from Catholic Health, CJ Erlab. CJ.
Well, good afternoon. I'm at a distinct disadvantage because the instructions were I only had 2 minutes. Joe, you obviously did not read the instructions. And it's also, I've known Joe for a long time. He's a tough act to follow. But I want to congratulate you on this momentous day, on this momentous occasion. Not only are you getting a new college, you're getting a new dean. When I grew up down the road a little bit, I'm not from this area like Joe is, but I will tell you your reputation, Niagara University's reputation for nursing extended down the thruway. I knew a number of people, number of students that went into nursing. Only the smartest ones came to Niagara University. You had a great reputation. I don't completely understand. Being in healthcare my whole career, could never understand what happened to the program and why it closed, because we always needed nurses. So when I came up to Lewiston and Mount St. Mary's, very pleased to hear the redevelopment of the College of Nursing, the School of Nursing. And then I was with Father not more than a few months ago, and he shared the great news of your accomplishment to be recognized actually as a School of Nursing. There has always been an important relationship with Catholic Health and the university through Fran, and a number of other individuals, and we take that not for granted. It really is an important partnership. In the future, as Joe indicated from the statistics, we are going to need nurses. There's already a shortage. I was just sharing earlier, we are paying our travel nurses, who we desperately needed to take care of the COVID patients, between $150 and $180 an hour. That's what the shortage means in a time of crisis. So there is an enormous need. The other thing I think that's important is the relationship that Joe and we have with the university, because you really are putting out top nurses. These are nurses that are ready to help us in some of the more difficult areas of nursing, whether that's critical care, emergency, or even some of the advanced med-surg nursing and the ORs that we need. I'll also end, I know Dr. Verney well, and when I heard that she was selected as your new dean, I was thrilled, because you may not know it, but I know you have a dynamo. Chris is so passionate for the professionalism of nursing. She will be an enormous, incredible leader for your program, and she comes right at the perfect time with the new college. So congratulations. Thanks for inviting me to be part of this. We look forward to a long partnership with Niagara University and the College of Nursing. Thank you.
CJ, thank you. Great to have you on the campus with us today for this announcement. You did mention that $180 an hour in nursing, and I thought, maybe I could switch careers. I'm 54, but maybe there's a way I could switch, maybe like a year and a half program. And then he said, and they had the smartest students, and I thought, it doesn't count me. But it does count the next person you're going to hear from, Tim Hinskin, who is a sophomore student in our nursing program. I'm holding the microphone because everybody else has been able to adjust it where it is. Tim, I have to put it up a little bit for. Ladies and gentlemen, sophomore from the school, now College of Nursing, Tim Hinskin. Tim?
Yeah, it's usually a bit of an adjustment anytime I come up. Good afternoon. I first want to thank everyone for allowing me to be able to come and speak today. So my name is Tim Hinskin. I'm a sophomore nursing major, and I have a minor in psychology, and I'm from a small town called Alden, New York, and it's about an hour away from here. Usually people don't know what that is, so I like to just say how far it is away. So I wanted to begin today by explaining why I chose a degree in nursing. So as a child, I was always enjoyed helping others around me and was fascinated by the sciences. I particularly enjoyed learning about the human body, how it worked, and how we were supposed to take care of it. So going into middle and high school, I had begun that thought of which career path do I want to take, where do I want to go? So at first, I wanted to be a lawyer, and I soon realized I did not have the personality to be a lawyer. So my mentality soon shifted towards the medical field. And there was one individual in my life who helped me choose nursing, and that was my Aunt Cheryl. She had been a nurse for almost 50 years in various positions, such as a floor nurse, a nurse manager, and many, many, many more. She was the recipient of the 2020 Distinguished Alumni Award from the University of Buffalo, and she still loves nursing today as much as she did nearly 50 years ago. So in talking with her, she described to me how the field of nursing was one of heart, compassion, empathy, and intellect. And by hearing this and many of her stories, I knew I had found my calling and aspired to be just like her in the future. And I'm now proud to say that I have 2 years left in completing my bachelor's degree in nursing and would not change anything about the past 2 years that I have had with the Niagara University School of Nursing, now College of Nursing. In having many discussions with various family, friends, and faculty here at NU, I have decided to continue my education even further. My future plans in nursing are to pursue a master's degree as a PNP, a pediatric nurse practitioner, and then continue on to earn a doctorate degree as a DNP, Doctor of Nurse Practice. With this education, I intend to return to Niagara University, hopefully, as a professor and continue my involvement in the university as a whole. I would not have even considered continuing on or pursuing higher education had it not been for the nursing program here at Niagara University. I have had such amazing experiences here that have contributed to my education across the board. One aspect of the program here at NU that was significantly beneficial to me was starting our nursing classes our very first semester. By doing so, I feel that I have a step ahead of the other students at other colleges and universities because I'm already building and expanding on my nursing knowledge over the course of 4 years rather than just 2 years. An additional aspect of the nursing program here is the exceptional faculty and staff within our program. The professors and administrators within our program are immensely dedicated to their students and want to create the best nurses possible. In my experience, each professor gets to know who you are, what you may struggle or succeed with, where you want to go with your nursing career, and how they can help you get there. They also want you to have as much experience as possible, as seen by getting our students into the clinical setting right away their sophomore year. The experiences I have had in clinical are incredible, from passing medications, placing telemetry units on patients, being able to interact with patients one-on-one, and forming close connections with the nurses and the staff at the hospitals are all things that I would never have thought that I'd be able to do in my sophomore year of college. But thanks to this university, I have. Finally, I'll conclude today with mentioning a few faculty members who have really helped me along my journey here at NU so far. Starting with Dean Coyne and Laura Holdhouse, both who have given me many opportunities to get involved in the School of Nursing and have supported me every step of the way. Dr. Frazini Godowski, who was one of my very first nursing professors, who really helped me understand nursing concepts and helped me decide that I wanted to pursue a master's and doctorate degree in nursing. Professor McNamara has been so supportive and encouraging this semester and is always there for us whenever we need her. And there are many more people who I could mention from the nursing program who have impacted us all, but these are just a few individuals who've helped me along my way and shaped me into who I am today. So in closing, I'd just like to thank the university and the School of Nursing for all the opportunities and the education that I received. And I look forward to seeing where the School of Nursing continues to grow and can't wait for Dr. Verney to be part of that journey. Thank you.
I'll readjust for that. Thanks, Tim. Congratulations. Thanks for being with us. Great to have you here, and great to see your experience at the university is going so well. But what I would say, and I am the PR guy, but I'll say it anyway, because it is true, his experience isn't unique. It's the other. We have other students here who will tell you the same thing, the same stories, the experiences they have that set them up for career success. So it's wonderful to have Tim here representing so many other students in the career, this career, and then the other careers as well. And some of that, you know, when you think about the university as a whole, when we establish programs, a new college, and that, it comes from visionary leadership. And we have a visionary leader here at the university. And to wrap things up today is my pleasure to introduce the president of Niagara University, the Reverend James J. Marr. Father?
My mass says live on campus, so just a plug for Residence Life. Anybody out there? Father Verni and I live on campus. We're in the Vincentian Residence Hall. The food's very good there. So I want to begin, thank you, Tom, and what a great talk. Thank you so much. We're so proud of you as our students, so thank you. Thank you for being here today, and what a testimony to the faculty and the instruction and the commitment. I just want to reiterate our thanks to Dr. Fran Crosby, who's here today, Nancy McGlynn, our former Dean of the College of Arts and Sciences, Barbara Malinowski, who has taught with us and is an incredibly supportive alum. I also want to thank Maggie Coyne. This, as you all know, has been an incredibly challenging year in the pandemic. And so Maggie, your experience as an emergency room nurse leader and manager, I'm sure, has come in very handy, but we're incredibly grateful for everything that you've done for us this year, so thank you. And thank you for serving our students so well. I also thank Dr. Chandra Foote, who led us with grace and deftness in this search process, and we have the best candidate, and we're incredibly excited to build a future together. I also think and thank Dr. Tim Ireland. Tim and I are going to develop a new motto for him as provost, and it's heavy is the head that wears the crown of thorns, because Tim is an incredible visionary. He's deeply committed to the academic enterprise, and he suffers, you know, for his great desire and passion. Rarely do you have a provost and an academic VP who will create great vision, who will walk around and who will immerse himself in the lives of our students and our faculty and our deans. So Tim, thank you for your leadership and for all that you've done to help make this day possible. I thank our partners who are here today from Catholic Help, CJ Erlab and Mark Sullivan. They are tremendous partners and great leaders in the field. It's not a coincidence that Catholic Health was granted major resources around vaccine distribution. It's a credit to your competence and to Mark and to your entire team. And I thank our good friend Joe Ruffalo, who just continues to labor in the vineyard of Niagara Falls and embodies the Vincentian mission in his own way in the great service and the high competence he and his team offer to our community. I also thank our partners in Kaleida Health, and we look forward to continuing to build out that relationship. When I talk to alumni and travel around the country and in the region, it's striking to me that we have a number of academic programs at Niagara University that jump right off the top of your head when you talk about mission. But nothing really surpasses nursing. Vincent de Paul committed his life to being a healing, transforming figure. And he was a person who committed himself to excellence in everything that he did. His biographer, Peugeot, writes, St. Vincent knew where every penny was in the ledger. But he immersed himself in a commitment to excellence in the Congregation of the Mission, in working with the Daughters of Charity, in in all his work with what we now refer to as the larger Vincentian family. And that's really what we commit ourselves to in nursing. It is compassion, it is empathy, it is intellect, it is mission in service to transform people's lives and to be the healing balm that people need in their most desperate and difficult moments. There's no better place for the heart of St. Vincent to beat than our newly established College of Nursing. The biblical passage that I'm going to quote is, "To those who are given much, much is expected." And that's what we believe with this gift of the College of Nursing. Much is expected of us. And so I want to call us forth, I want to challenge us to renew our commitment, to deepen, to strengthen our commitment to public health in the region of Western New York, in Niagara County, and in the city of Niagara Falls. We must do this. We must cross the bridge of health inequities and bring people together for their lives, for their health, for their wellness, and for the very goodness and grace that nursing brings. I believe Chris Verney will lead us to new heights, regionally, in New York State, and nationally. And I pledge as president to do everything I can to be her partner, along with everyone else, to make that dream and vision a reality. Welcome to Niagara, Chris.